All right, Tanya, why don't you go ahead? Thank you.
Okay, hi, so I'm Tanya Vayngortin, one of the ED fellows. Today I'm going to be talking about pediatric ingestions. So the learning objectives for today are to identify the most common pediatric ingestions, list the medications that we name one pill can kill, which are the most dangerous in kids, identify household products that can cause serious toxicity or death, how to initiate resuscitation and management of common ingestions, and to become familiar with common toxidromes. So each year, over 1 million ingestions in children under 5 are reported to poison control centers, and over 50,000 kids present to the ED annually with ingestions. So the distribution by age is bimodal, most common in toddlers, which tends to be the unintentional ingestions, and then more intentional and basically suicide attempts in adolescents. So toddlers are the highest risk age group. They tend to be the most active. They're starting to run around a lot, explore their environment. They're strong enough now to open containers. And as we know, they're trying to put everything in their mouth. And then the most common culprit, as we've seen, is like usually grandparents' medications. So these percentages are just showing where they usually find the medications. So 67% are left within reach, so on a table or chair. 15% are grabbed from a pill box, and 6% they're able to get from a drawer or cabinet. And then the most common pediatric ingestions that are reported to poison control are cosmetics, personal care products, household cleaning substances, analgesics, foreign bodies, and topical preparations. And then the top 10 most common medications that get reported to poison control are basically some of the most common medications we use. So ibuprofen, Tylenol, vitamins, antihistamines, laxatives, homeopathic medications, antibiotics, calcium supplements, diphenhydramine, and diaper rash products or other creams. And then the most common ingestions we see that are fatal are opiates, particularly methadone because it's so long acting, and fentanyl because of its potency, acetaminophen, street drugs, tricyclic antidepressants, the antidepressant bupropion, salicylates such as aspirin, quetiapine, the antipsychotic, and calcium channel blockers. And some of these are known as basically the one pill can kill. So I'm going to be covering all of these in more detail, but even a small amount of any of these medications can be fatal in a pediatric ingestion. So these include opioids, clonidine, oral hypoglycemic medications such as sulfonylureas, calcium channel blockers, beta blockers, camphor, salicylates, particularly the oil of wintergreen, topical imidazolines, which are used in eye drops like Visine, nasal spray, and various creams, and tricyclic antidepressants. So I'm going to present some cases, and then we'll kind of discuss each of these in detail. So the first one, this is a 2-year-old male found down at home, limp and unresponsive. These are his vitals, so temperature of 36, heart rate 60, respiration's 8, blood pressure 90/60. He has shallow breaths and pinpoint pupils. So what would we worry about?
Well, the respiratory rate, obviously.
Yeah.
And shallow breaths.
Yeah. And what would you be
pinpoint.
suspicious of? What kind of ingestion or medication?
Probably an opioid, yeah.
Yeah, opioids, exactly. So these are the list of the most common opioids. So as we saw in this patient, they present with respiratory depression, and then basically everything is down. So lower blood pressure, lower heart rate, lower temperature. They can have lethargy and coma. And just some of the other unique features to some of these medications. So methadone is associated with a prolonged QT, and tramadol and meperidine or Demerol can cause seizures as well. And this is a series that was published by Our Poison Control last spring. I don't know if you guys had heard about, but there was an outbreak of this counterfeit Norco all over the Bay Area. And there were basically people buying Norco from the street and taking just one pill, and then they would come in with severe respiratory depression, coma, there were deaths. And then when they tested these pills, they found that they actually had fentanyl, so which is much, much more potent, and they had much more serious effects. And some of them also contained promethazine, which is like a cough syrup, what people were taking to increase their high, basically. And I think we had a case of this at Mission Bay as well. So that's another thing that's important kind of for people to know about, even if there's a history of just taking one Norco, that these products are out there and could contain something more. So for management, of course, we always focus on our ABCs, especially if there's respiratory depression. If we know that the ingestion occurred within the last hour, and if the patient is still awake, they can get activated charcoal. And that'll be the thing kind of for a lot of these ingestions. Activated charcoal is helpful, but really should only be used if the patient is awake enough. We don't want to risk aspiration and vomiting. And it's most effective before the drug has been absorbed, so if the ingestion occurred within the last hour. For opioid ingestion, we use naloxone. And the nice thing is it can be given pretty much any way, so IV, IM, IO, intranasal. The dose for pediatrics is 0.1 mg per kg, or 2 milligrams for older children and adolescents. And that can be repeated basically every few minutes as needed. And we usually go to a max of 10 milligrams. So the next case is a 12-month-old baby who was found unresponsive in their crib. The temperature is 37, heart rate 70, blood pressure 60/30, respiratory rate of 20. They have meiosis of their pupils. And on further exam of the baby, this object was found in the mouth.
Ooh. Patch, no patch.
A patch, yeah. And what medications? What do we worry about that coming up?
Fentanyl.
Yeah, fentanyl patch. What else?
Nicotine.
Any other ones? Yeah, nicotine. And then this one is actually a clonidine patch. Yeah. So clonidine is a alpha-2 agonist, and then initially can cause hypertension and tachycardia, but then later progresses to hypotension and bradycardia. So you get kind of similar to the opiates, similar presentation. You can get CNS depression, respiratory depression, meiosis, hypothermia. So a lot of similar physical exam findings, and you would definitely see a similar presentation with the fentanyl patch as well. So similar management, ABC, supportive care, and there actually are cases where even though it's not an opiate, I did find some cases in the literature where naloxone helped these patients with clonidine overdose. So it's definitely worth a try as well.
So what is the half-life of clonidine? Does it?
When I was looking, it's pretty variable. I think it can be like 12 to 24 hours. Yeah, the patch lasts quite a long time. Yeah.
Even after taken off?
Even after taking it off, yeah. I don't know exactly the duration of after you remove it,
Okay.
but I think it takes, can take about 24 hours to clear. And this is commonly used, and we see it in adults used for hypertension, but also in some of our kids with ADHD and behavioral issues. Some of them are on clonidine. And this is another just drug to know. So guanfacine or 10X, which some kids are now on for ADHD, which basically has the same mechanism as clonidine and can cause the exact same presentation and overdose. So another thing to know about with some of our ADHD patients if they present like this. So the next one is a 2-year-old girl brought in by EMS with a seizure, and she's found to have a finger stick glucose of 30. So what medications in the home that we would worry about?
Probably like metformin or
Yeah,
something.
yeah, exactly. Diabetes medications. So sulfonylureas, which are used in diabetes, and their mechanism is to increase insulin release from beta cells in the pancreas. So this is a list of the most common ones we see are usually the glipizide and glyburide. So one of the main side effects of these medications is hypoglycemia. So especially in an overdose, and because small children are at higher risk of having hypoglycemia anyway, and the small children are sometimes more likely to be fasting, running around, not eating as often, so they're definitely at highest risk of having hypoglycemia. And in children with sulfonylurea overdose, their hypoglycemia can be prolonged and severe and sometimes delayed. So they have to be watched a bit longer. So they can present with lethargy, diaphoresis, just being jittery, nausea, and then can progress, if it's severe, to seizures and coma. So if they're hypoglycemic, we give them dextrose. Again, if it's been within the last hour, they can get activated charcoal. Sometimes their hypoglycemia can actually not respond to dextrose boluses, and so the other medication we use is octreotide, which basically inhibits insulin release. So it's kind of trying to reverse that process. And that can also be given in boluses, either sub-Q or IV, or it can even be as a drip. Even if patients come in, if they had a known sulfonylurea ingestion, but they're asymptomatic, they should still be admitted for 24-hour observation because sometimes they can have a delayed hypoglycemia. And there was actually another kind of counterfeit pills that they saw some cases at Poison Control where people were buying Xanax off the street and were presenting with hypoglycemia, and that was actually found to be sulfonylureas, so as well.
How come we haven't seen the use of octreotide?
I was just gonna say, I did.
Yeah, usually they respond. Yeah, I asked about it too when I was on toxicology. Usually patients will respond to just dextrose, so it's usually only if it's really severe then they kind of have to go to it. But yeah, I haven't seen it used much either, because I think usually it's not after they get dextrose like once or twice they do okay. And the next one is a 2-year-old found to be lethargic next to grandmother's pill box. Temperature is 37, heart rate of 50, blood pressure 68/34, and respiratory rate of 20. So what medications would we worry about with like hypotension, bradycardia?
Beta blocker or calcium?
Yeah, exactly, perfect. Yeah, so calcium channel blockers and beta blockers. So calcium channel blockers, they basically bind to and antagonize calcium channels, preventing calcium from entering the cells. So the main areas where this has impact are the blood vessels, smooth muscle. So if they block it there, you get vasodilation and hypotension. In the cardiac cells, you get decreased contractility, thereby you get bradycardia. And they also affect the beta cells in the pancreas, which produce insulin, so you get an inhibition of insulin release. The most dangerous ones in pediatric ingestion are verapamil and diltiazem. Those have the most severe effects. So you can get hypotension, bradycardia, and that can progress to asystole, lethargy, confusion, and coma. And because you're inhibiting the insulin, with this one you get hyperglycemia. So that's that's pretty unique to calcium channel blockers. A lot of the other ingestions will cause hypoglycemia. So hyperglycemia is basically one hint to this one. And for this one, again, activated charcoal if it occurred recently. You want to support your blood pressure, so IV fluids, and sometimes they need to go on pressors. Atropine can help with your bradycardia. Giving calcium, so calcium gluconate or calcium chloride. And then hyperinsulinemia euglycemia therapy is another option. So basically because you're inhibiting your insulin, you can kind of give insulin to support that, and then you also give glucose so that you don't have hypoglycemia. And then with giving insulin and glucose, you're also helping kind of glucose get into your cardiac myocytes and helping them function better. So you're going to help the cardiac aspect of it, and then if nothing else works, ECMO is kind of a last resort as well. And then again for this, they can also have a delayed presentation, so even if they're asymptomatic, they also get admitted for 24 hours. And I've seen some of these, even if asymptomatic, get admitted to the PICU just because of the concern for like, if they could develop hypotension. Beta blockers, similar presentation, so we know they reduce cardiac contractility. And the most common ones we see, labetalol, propranolol, again, can cause bradycardia, hypotension, arrhythmias, CNS depression. And then beta blockers, as opposed to calcium channel blockers, cause hypoglycemia. So beta blockers block basically pancreas release of glucagon, and so they cause the opposite effect. So for management, again, ABC is activated charcoal. You can give glucagon to kind of help stimulate that glucose release, and glucagon will help with the cardiac contractility as your glucose gets into your cardiac cells as well. And then again, for the hypotension, fluids, pressors, and then for this one also, this insulin with glucose can help.
So that's how you tell between the calcium channel blockers and the
Yeah,
beta
that's one
blockers
hint,
is by
because the
glucose.
other things are pretty similar, like bradycardia and hypotension, so the glucose can give you a hint, yeah. So the next one is a 2-year-old girl who's been home with a cold, and mom's been putting Vicks Vapor Rub on his chest, and he's found altered and sleepy. Does anyone know what the ingredient is in this? Yeah, exactly, good, yeah, camphor. So camphor can come from distillation of a tree bark, or it can be produced synthetically. It's very toxic because it's very lipophilic, and so it basically moves through cell membranes, mucous membranes, skin very quickly and distributes really quickly. And I was reading even like 1 tablespoon of Vicks Vapor Rub can cause death basically if ingested. Yeah, which I didn't know was that extreme. So mostly neurological symptoms. They can have confusion, restlessness, seizures, even coma, respiratory depression, nausea and vomiting. And for the management, you want to really make sure, because it can be absorbed anywhere, you want to make sure you like thoroughly wash their skin, remove clothes, anywhere where it could be absorbed from. Activated charcoal. If they're asymptomatic, you still want to observe them for a few hours, make sure they're not developing symptoms as the medication is getting absorbed, and again, supportive care.
Tanya, what age did you say? Any age? Or up to age, like under age 6? Or?
Yeah, under age 5 usually, but like toddlers, kind of the smaller they are, the higher risk, because there's more just body surface area.
So you're too young, but on the commercials, they used to show Vicks Vapor Rub for those little kids.
Yeah, it was
On
really
the
popular, and we
commercials.
still have families that use it.
Well,
so,
it's
yeah.
an old-fashioned
Yeah.
thing.
Yeah, definitely. I think it's not really well known about this. They don't, yeah. Okay, and then the next one, 15-month-old girl with lethargy, vomiting, and tachypnea, and then mom found this bottle of oil of wintergreen by her bed. Anyone know the ingredient in this? I just learned this one.
Salicylate.
Exactly, yeah. Yeah, salicylate. So salicylate is found in a lot of really common products, like Bengay, a lot of the topical creams that we use for pain and kind of anti-inflammatory, a lot of fragrances. Basically this uncouples oxidative phosphorylation, which is in the mitochondria metabolism. So basically destroys mitochondria, which is extremely dangerous because it will shut down all our organs if our mitochondria don't work. And again, this is highly toxic, so 1 teaspoon of this oil of wintergreen is basically equivalent to 22 aspirin tablets. So again, even up to like 1 tablespoon could be fatal of this. There was actually a case in 2007 of a cross-country runner who died after excessive use of these like Bengay, like muscle pain type products. Yeah, because they were using so much and it was even absorbed through the skin. Yeah, it's scary. So presentation, again, can be nausea, vomiting, lethargy, confusion. Salicylates cause tinnitus, so that's kind of unique to that. Seizures, coma, you can have tachycardia, hypotension, arrhythmias, and then the classic finding that we see on our blood gas is a respiratory alkalosis and an anion gap metabolic acidosis. So you'll see both basically a low PCO2, and then they're having that kind of tachypnea, like really hard breathing, driving down their CO2, and you'll see a low bicarb as well. So this is, any salicylate ingestion should be kind of suspected if we have a patient with tachypnea and we don't have any other explanation. This is kind of the other thing to think about. Treatment for this, so activated charcoal. Sometimes they need to do a whole bowel irrigation with basically drink and go lightly. So especially if you take like a bunch of aspirin tablets, they can kind of clump together. And so sometimes you need to like wash it out, like that charcoal won't be enough for them. And then also for the acidosis, you can use sodium bicarbonate. That'll help alkalinize the urine and again kind of help excrete it. And then if that's still not enough, and if it's a severe ingestion, then they have to get dialysis. So the next one is a 23-month-old girl. She presented with lethargy, confusion, and became unresponsive. Upon further history taking, mom saw her sucking on this bottle of Afrin earlier in the day. And you remember the ingredient in this one? This is kind of a hard one, yeah. So it's, I didn't know this name before either, but it's imidazolines. So basically these are the ingredients found in a lot of nasal sprays, so Afrin, Otrivin, and then also in Visine. So there's been, I know sometimes in like TV shows or movies, they talk about putting like Visine drops in someone's drink. That can actually be like very dangerous. And I saw, there was a case report of a child who drank like a juice with Visine that was actually maliciously intended for another family member.
Oh my God.
Yeah, and they like died from it, so yeah, it's crazy. So these stimulate the alpha receptors. Kind of like clonidine, you can initially have tachycardia and hypertension and then later progress to bradycardia, hypotension, and then respiratory depression. Okay, so, and again, kind of supportive care for those. The next one, so 2-year-old brought in by EMS with seizures. EKG shows a prolonged QT, and we find out that mom has a history of anxiety and depression. So which medications?
Antidepressant.
Yes. Yeah, tricyclics. Yeah, exactly. So tricyclics such as amitriptyline, nortriptyline. I feel like we see this one a lot. I mean, more in our teenagers, but which can block sodium channels and have anticholinergic effects. This one is the 3 C's, so convulsions, cardiac, and coma. So that's kind of a mnemonic for that. So you can have seizures. For cardiac manifestations, we see abnormal EKGs, so prolonged QT, and you see a wide QRS, and hypotension, and then could progress to coma. Treatment for these, again, activated charcoal, and then also sodium bicarbonate, which can help, especially for the wide QRS. That one can help treat it as well. So these are just some tips for if we don't have a history of any known ingestion, of kind of how things that can help us figure it out. So getting a good history, so both the patient's medical history and the medical history of any family members, what medications are in the home, the name of the medication, strength, so if it's extended release, that will make a difference, how long we watch them, quantity, if we don't know how much they took, we can check the prescription and how much is left in the bottle, time of ingestion, There's this website that has, and I can send this to you guys, but you can actually put in like what your pill looks like, a description, and then they can tell you kind of what options are to figure out what it is. Asking about any over-the-counter products, like we talked about the creams, oils, household ingredients. And then on our lab, so finger stick glucose, that's a really easy first test. Blood gas, again looking for like acidosis, anything that might clue us in. EKG changes, and then our kind of standard urine tox screen, Tylenol, salicylate, alcohol level, all of that. And then this is a diagram of common toxidromes, so just things that we can look for on physical exam that will help clue us in. So the first one is anticholinergic. So this is the dry as a bone, hot as a hair, mad as a hatter. You guys have heard that one? So basically everything is kind of stimulated. So the hot as a hair, so they're often febrile. Blind as a bat, so they get dilated pupils. They're red as a beet, they can be flushed. Mad as a hatter, they're very altered. And then dry as a bone, they're not sweaty. And this is what's seen with like atropine. Oftentimes, this is one of the side effects in Benadryl overdose, TCAs, and then like Jimson weed. It's a common one as well. And then cholinergic is the opposite. So cholinergic is more like kind of parasympathetic nervous system, and it's the mnemonic for this is sludge, which is basically like everything leaking. So salivation, lacrimation, urination, diarrhea, vomiting, they're kind of leaking from everywhere. And that's classic with organophosphate poisoning, which we don't see here, probably more in like kind of farming areas, but that would be the presentation for that. Our opioids, so as we talked about before, again, you get everything going down. So constricted pupils, low temperature, low heart rate, low respirations. And then sympathomimetics, basically the opposite, everything is stimulated. So this is what we would see with cocaine, amphetamine, methamphetamine, tachycardia, hypertension, dilated pupils. And then the last category is sedative hypnotics. So this is what we would see with our benzos, barbiturates, alcohol, also like Benadryl. And that causes, again, everything suppressed. So you have slow breathing, slow heart rate, all these features. So we can use these on physical exams to kind of help us figure out which one of these is. So I wanted to also cover a few common household items that are dangerous. So Tide Pods, which we've been seeing pretty frequently. As you can tell, they're usually very colorful, so kids think they're candy. They contain toxic alcohols, and even just ingesting one can be fatal. So a lot of times they come in with signs of aspiration. They can have coughing, choking, gagging, and then depending on if it goes in their airway or if it goes into the GI tract, they can have nausea, vomiting, esophageal perforation, can progress to coma. Activated charcoal is not indicated here. It won't be helpful, and also you risk aspiration. If it gets in the eye, sometimes they'll open it, it'll splatter in their eyes. You want to make sure you're irrigating their eyes, removing any clothes that it could be on. And the next one has similar toxic alcohols, so methanol, ethylene glycol, isopropyl alcohol. These are seen in our windshield wiper fluid, antifreeze. I had one of these a few months ago. They drank some antifreeze like from the garage. They were kind of found splashing around in it. So yeah, you can have hypoglycemia, kind of same as with an alcohol ingestion, CNS depression, respiratory depression. Again, with this, your blood gas will give you a clue, so you'll see NN-GAP metabolic acidosis. Activated charcoal is not helpful with the alcohols. It doesn't bind them well. And the antidote for this one is fomepizole. So it inhibits your alcohol dehydrogenase, basically inhibits the metabolism to the toxic metabolites. So that would be the antidote for this one. The next one is hydrocarbons. So these are found in so many household items. So a common one we see is pine oil, but also glue, nail polish, paint remover, gasoline. Again, these are very lipid soluble, so penetrate into the CNS really fast. And they also penetrate into our respiratory tract and cause like basically direct CNS injury, cardiac and respiratory injury. So initially they can be asymptomatic and then kind of rapidly develop symptoms. So in the respiratory tract, you can have aspiration, which leads to a severe chemical pneumonitis and can actually lead to a necrotizing pneumonia. You can have cardiac toxicity and arrhythmias. You can have lethargy, dizziness, seizures, and progress to coma. And sometimes there will actually be an odor on the patient, like from, as we can smell, like pine oils or nail polish. So that might give a clue to this. So for these, also activated charcoal doesn't bind it well, so not really helpful. Our ABCs, and then again, because of this risk of respiratory injury and pneumonitis, usually the patients will need oxygen and will get a chest x-ray. You want to make sure you remove any contaminated clothing, clean their hair, skin, eyes. Anything needs to be kind of aggressively cleaned and irrigated. And then just to review the uses of activated charcoal. So basically the way it works, it binds to toxins so they're not getting absorbed, and instead it kind of pulls them through the GI tract so they're stooled out. Usually we do 0.5 to 1 grams per kilo, and it works well for large, poorly water-soluble compounds. And then this is the list of medications it doesn't bind well. So iron, as we talked about, the alcohols, lithium, acids, alkalis, arsenic, heavy metals, and hydrocarbons. And then again, you only want to use it if the patient is alert. So if they're altered at all, it's not safe because they can aspirate, and then if they aspirate the charcoal, they can have pretty severe pneumonitis. And then just kind of poisoning prevention. So always talk, even if they're asymptomatic, always want to like counsel our patients and parents about this. So making sure they know how to contact poison control, counseling, and then also it's important for us to always call poison control, even if patients are asymptomatic. They can be really helpful with advice, but they also keep track and document all the ingestions. So we have to notify them, and then counseling parents on keeping medications, household products, even things we think are benign like these creams, make sure keeping everything out of reach. Not telling patients like, oh, this is candy, not taking it in front of them because kids will kind of tend to mimic adult behavior. And then also, if we know parents are on any of these one pill can kill list, making sure that they know like how dangerous even a small amount of these medications are. Okay, that's all I have. Any questions?
That was really great.
It was great.
Okay.
Thank you. We will bring this up, this will be part of our triage orientation too in a couple of hours.
Oh, awesome.
Triage category for all ingestions are one.
Yeah, totally.